Greetings, everyone. This is Eric Glazer, and welcome to Bright Spots in Healthcare. We're produced by Bright Spots Ventures, and each episode, we bring leaders together like the ones you see before you today from health plans, hospitals, and other leading healthcare organizations across the land to share proven strategies that drive measurable impact. And through our podcast, our private executive councils and private events, and our go-to-market strategy work, Bright Spots Ventures surfaces innovations that work in real-world healthcare settings. What we're trying to do at our core is foster trusted relationships. Think of this show as kind of building a relationships at scale, but we want to foster relationships that fuel progress because we believe the best way to improve healthcare is to find what's already working and figure out how to scale it and clone it. If you haven't subscribed to the show yet, just know our mission is simple. Each and every episode, spotlight what's working in healthcare and help scale it. So if you open up your favorite podcast app or go to YouTube and type in Bright Spots in Healthcare, you're going to get access to all the episodes, all the great guests we have, all the great ideas, all the things that are already working that could help you do your job just a little bit better. So just hit subscribe and you'll be able to get all those insights delivered to you. Today's episode, obviously covers a topic, I feel like every day we're talking either about AI or GLP-1s or both. And they're both developing fast and furious. And so when you think about where we're going now with obesity and cardiometabolic care and the integration now of GLP-1 therapies into broader care and benefit design, that's what we're going to be talking about today. And we're calling this the GLP-1 integration playbook. So you're going to hear about how innovators in our industry are doing things just a little bit differently as we're learning more, testing more, and trying to get this right. So true value is being delivered to all the parties involved. So it's all about health plans and all of you listening to the audience who are health plans, moving beyond your point solutions to connect benefit design with your care teams, behavioral support in ways to deliver greater outcomes and value. And I know that's something you've said in your conference rooms a million times, but it's really hard to execute, right? So we're going to get into all of that. Our guests today, and we're going to put their bios in the show notes of your podcast, and if you're watching on Zoom live, we're going to put it in the chat. Our guests today are Angie Kalusek Abrahima. She's the Senior Director of Lifestyle Medicine, Blue Shield of California, one of maybe the top 10 leaders in appearances on Bright Spots in Healthcare, potentially. We don't know that officially. We've got Bethany Stein. She is the President of Pharmacy at Humana, and we have Cody Fair, the Chief Commercial Officer at Noom. Again, check out their bios. Incidentally, Noom is one of Bright Spots in Healthcare's latest partners who support our episodes, and this one in particular. If you haven't heard of them, I'm sure you have. They offer comprehensive digital health platforms that combine psychology, technology, medication, and coaching, and they have a platform that's just helped millions. They started as a direct-to-consumer play, and millions of people have met their personal health and wellness goals, and they enable each person to build lasting habits to achieve those results and keep those results sustainable. So you could check them out at noom.com/health. And I'll tell you a little bit more about that maybe later on in the episode. This is the way I'm thinking about today. And it harkened back when you thought about Netflix, when they first started streaming, right? They weren't the first company to deliver us movies online. Others had, but they were a little bit clunky and a lot of buffering. Those of you my age remember the buffering and limited libraries. But what they did differently is they didn't just focus on technology. It was all about integrating everything. They built a seamless experience connecting the data, personalization, and the delivery so that the right content reached each one of us at the right time. And that integration changed not just how we watch, but like literally how we expect to be served, right? Like think about the crisis in your household when someone accidentally uses your profile on Netflix and it changes things on your profile, right? It's a catastrophe. At least that's what my daughter's name when I did it once. So that's the opportunity facing us in healthcare, not so much the Netflix thing anymore, but using GLP-1 therapies and the medications, they're not new, but the opportunity now, right, to integrate into a connected, clinically guided member journey instead of just GLP-1s being isolated over here. We're thinking of some of the plans and some of the stories you're going to hear today are linking them with behavioral support, nutrition, mental health, and ongoing care, right? And that's delivering the results. So just like Netflix proved their corporate value and increased their corporate value by not just serving that single show, but that full experience, health plans listening to that, you have that real opportunity to take things like a expensive yet effective GLP-1 therapy and integrate it into benefit design and coverage strategies and member engagement programs at work. So that's the focus of today. That sets the stage. We're going to talk about how plans are building smarter pathways that flex to employer and their fully insured population's needs. And so that's what we're going to do here. And so, Bethany, I'm going to start with you. Again, Bethany is the president of pharmacy at Humana. And from your vantage point, how would you describe the biggest shift in your pharmacy strategy over the past few years? And what does that look like today in practice?
Thanks, Eric, and thanks for having me. I think when I take a step back and I look at our pharmacy business from where it was 30 years ago to where it is today, a couple key elements stand out for me. One, we were built by the health plan for the health plan. And so our North Star has always been outcomes, which still drives a lot of the culture today. And so when I think about how much we've grown in scale over the last 30 years, today we stand to be the fourth largest PBM, a top 10 pharmacy. We are a top 6 specialty pharmacy. So that scale has grown tremendously. We have that outcome orientation, right? We study this every single year where we have and show 2.5 times better medication adherence in patients using our pharmacy over others in our network. Same thing with medical cost outcomes and total cost of care. I see about $450 on average lower, again, when people are using our pharmacy as compared to others in our network. The thing that was missing, though, was the consumer centricity. Right? The final key piece in really taking our pharmacy business from an internal focused pharmacy business to serving external customers. And so we invested heavily in the early 2020s in customer experience and engagement, especially in the digital channels, so web and mobile apps. And we created this experience that customers genuinely wanted to use. And it worked. Like, customer retention is at 95%. And the percentage of scripts that are filled via our digital app is like 50%, up from 21% in 2020. And so the icing, though, on the cake on all of this was the fact that our net promoter score is now 87, which is winning us awards, specifically the MMIT Patient Choice Award that I believe we've won for the last 6 years. And so this really allowed us to market pharmacy, again, being built by a health plan, to customers outside of Humana. And given now we offer that full suite and that full package of scale, outcomes, and now award-winning customer experience.
Okay, that's really impressive. We're going to dive into a little bit how you achieved all that in a bit. So hang on. I'm going to bring in Cody Fair, who is the Chief Commercial Officer at Noom. And Cody, part of what I think fuels a consumer-centric strategy is this incredible focus you have to have on building trust with the consumer. And you started as a direct-to-consumer play. And I'm wondering now, if you, as you're working across the industry, can you provide an example of how a health plan is leveraging sort of trust as currency?
Yeah, absolutely. I appreciate the question. For us, I think we look at trust as not being optional, but it's foundational when you're working with a consumer. And if you think about healthcare, it's a unique industry that you're sharing very personal data about your life, your body. And if there isn't trust, there's likely not going to be engagement, follow through, or any real change. So it is exciting to see that we're seeing forward-thinking health plans starting to treat trust as a strategic asset and not really something that just happens by accident. Historically, if you think of interactions in the healthcare industry, it starts from a very clinical place. What's your weight? What's your BMI? What conditions do you have? And it's certainly important information, but it feels very cold, even a little invasive. You learn a lot about somebody's health, but you've not really learned anything about them as a person. So one of the Blues plans that we work with decided to kind of flip that model on its head instead of focusing on compliance and checking boxes and tracking numbers, it was more focused on connection and understanding. One of the ways that we do that is what we call your ultimate why. And it's a simple idea, but it has a huge impact. So instead of asking what's your goal, we ask, why does this matter to you? So instead of somebody saying, I want to lose 10 pounds, which is great, we want to go deeper into that. We want to understand, maybe it's you want to be around for your grandkids, or you want to feel confident when walking into a room. And that's where the real motivation lives and where the trust starts. So psychologically, when a person identifies their why, it changes everything. It creates ownership, self-belief, and resilience. And in turn, the health plan helped them get there, and they're starting to be looked at as a partner instead of just a plan. For me, a personal story, my ultimate why and my journey with Noom actually began 2 to 3 years before I came to Noom. I was a Noom user myself, went into the program, and it took me through the ultimate why. And I was like everyone else. I wanted to lose 30 pounds. I wanted to do this. I wouldn't necessarily consider myself a deep thinker, but this kind of forced me to get deeper. And my ultimate why turned out to be for my kids. They're younger kids that love sports. They always want to go out in front, throw the football, baseball, shoot a basketball. And I didn't want to be sitting on the couch with no energy and not out there with them like my dad was for me. So that became my ultimate why that Noom ultimately helped me get to. But it was really only the first step in that journey, but it was the first step that built trust between myself and Noom and what we seek to do with our product. If you start from a place of trust, then you have to kind of build it through every step of the journey. It's not just onboarding. You need to continue to engage members so they feel known, supported, guided. And that is really kind of the big takeaway, is that trust can be the most valuable currency, and in what earns a plan the right to guide someone through change, which we're seeing in this relationship that I mentioned previously. But when you allow that member to take that first step through a relationship of trust, it's what keeps them going when things start to get hard, because the journey with weight loss specifically is going to be hard, right? There's going to be hiccups along the way. But if you've built that trust and started out kind of in a consumer-centric model, it's really going to help you throughout.
Okay, there's a lot to unpack there. Thank you for sharing that personal story. And yeah, so what I'm hearing you say, and this Blues plan, and obviously you guys are supporting them to do this, is, and I'm sure there's a lot of different integration points, and you even alluded to it takes more than just the intake, but they're taking the intake, which is sort of this, right, for most of us listening, let's be honest, it's just a check the box, table stake, administrative task, and we're actually creating an opportunity to develop a relationship that's just different. And you call it the platform you're calling it, in the way you're going about it with your health plan partners, is my ultimate why. And I could see, like, if you're asking folks what your why is, it's just a different way of thinking while you're interacting with something either digital or in person with either a hospital or a health plan for that matter. And it just creates a different rapport. So I could see how that, just thinking about it, if I was going through that, how that would work. And then as you're doing that, you're then thinking about different ways to interact with that person moving forward. And we'll get into that later on in the show a bit. I really like that. Anything that I missed there?
No, I'd say you nailed it.
All right, great. I want to, Angie, I'm going to bring you in, and we want to talk about Blue Shield of California now. So, like, how are you guys approaching member support and engagement for those just starting off with a GLP-1 therapy?
Yeah, and I think it almost goes back to the overarching strategy for obesity management. So I like to think of GLP-1s as a tool in the toolbox of helping members, and so many of our members who are trying to lose weight. So number one, let's talk a little bit about the GLP-1s, because Eric, I think the last time you and I talked about this was maybe early 2024. And so we've made some changes since then. We were seeing like 300% increase in the demand for GLP-1 medications. We were also seeing that people were not even reaching 12 weeks on the GLP-1s. 58% of people were dropping off the medication before week 12. And so as a health plan that is covering the cost of these medications, we have to be very mindful about getting the right people into the right program for them. That might be using a GLP-1 medication. It might be using a lifestyle-based application or program or clinician intervention that we provide. So number one, on the GLP-1s, we are moving towards a model where we support GLP-1 utilization for weight loss for people who have class 3 obesity or BMI of 40 or higher. That currently exists in our individual and family plan business and our small groups. And starting 1/1/26, that will be the case for our commercial group customers, both kind of mid-market and large. We are kind of making that shift in the medical policy was like the first step to get our arms around controlling the costs, but we don't want to leave members that are in that 30 to 40 range, kind of like high and dry, right? You're not going to be able to use the GLP-1 medication. So we want to make sure that there is sort of a wealth of opportunity for you to address obesity. What we're doing right now with kind of consumer engagement is we have a step therapy. So before you get the medication, you need to participate in a weight management program for a minimum of 6 months. And we have a program, as you know, called Wellvolution that has a whole host of weight loss programs that members can engage in. So we are sending information out to the members when they get that initial denial that says, you have to do the 6-month step therapy. And we are inviting them to join the Wellvolution programs. It's interesting because, I think in 2024, we sent like 30,000 emails out to people letting them know that these programs were available. And 10 to 15% of them kind of took the bait. So I think what we begin to see there is there are groups of people that really just want to take the drug without doing the work on the lifestyle side. And we think that those are the people who would drop off after, a short period of time. But what we want to make sure is that the members that need the medication can get it, can get to the utilizing the medication with the support of the weight management program. And for those who either don't qualify or don't need it or don't want it, and there are many people out there that want to do it other ways, we have kind of that whole host of programs for them. Once members are getting into these weight loss programs, we're seeing about 30% of them hitting clinically significant outcomes. So, in the world of weight loss, it's a pretty good metric. And these are both on and off GLP-1 medications. We are now kind of our next step is moving towards, for those who get onto GLP-1 medications or other weight loss medications for that matter, that they have clinical support. So we can triage them from the lower level weight management program to a program where their obesity management, their clinical diagnosis is supported by clinicians, by nutritionists, by behavioral health practitioners, so that they can get that true holistic care. They can mitigate side effects, titrate dosage if needed, and ultimately, if they want to get off a GLP-1, can do so safely.
Okay, so there's a lot there. That is really interesting. So it sounds like, if I could summarize, one is you're kind of creating a prior auth requirement. If your doctor gets a PA if you're in this program for 6 months, sort of like it weeds out folks that might not have been successful with the drug anyway. It's kind of like the Navy SEALs BUDS program, right? It's basic training. And so you're in it for 6 months, and then you have the prior auth. And for those who don't qualify for that based upon their condition, they could jump into other programs that are integrated into Wellvolution kind of digital space.
That's right.
Okay, I'm going to come back to you. I love this because it's all talking about options. It's all thinking creatively about how to take a drug that's working, but is right now really expensive, and integrate the other important components into it. So I want to come back to Bethany's time at Humana. And Bethany, you talked about these incredible, I think it was 87 NPS score, and just the incredible results you guys have achieved over the last 5-6 years. How are you doing that? Can you walk us through how your program actually operates and what you think drives such unusually high member satisfaction scores?
Yes, of course. I would say that at CenterWell Pharmacy, it was built around a high touch, but also high quality and efficiency kind of place. And I would say the two can ultimately coexist, right? You can have the efficiency and you can have the high touch, which I feel like the two haven't really coexisted in the past. So on the one side, we obviously use various forms of robotic process automation, artificial intelligence for years, and that is embedded in our pharmacy. We often automate small tasks, and that really reduces errors and improves our efficiency. And so collectively, these improvements have resulted in our pharmacy having quality levels materially higher than a typical retail pharmacy. And so while, of course, a human pharmacist, being a pharmacist myself, has to review every single script for safety, the dispensing itself is done automatically. So on the other side, we put our clinicians really at the center of the majority of our work, which really makes us high touch. And so we have a team of pharmacists 100% dedicated to working with patients on clinical questions or issues, and they're available 24/7. So the other thing we have is disease-specific centers of excellence. And these are nurses and pharmacists who have that expertise and certification in those specific conditions. They work with patients and doctors throughout the patient's treatment journey and just ensure that the members are taking their medications as prescribed. They help with side effects and other questions they may have and really act as a key member of the care team. We also use automation and AI to help streamline the pharmacist's job as well, right? Making sure that they have everything at their fingertips to quickly identify drug-drug interactions or other various safety concerns. And then I would say lastly, again, the holistic care of the patient and affording their drugs is a key piece or a key barrier that we see. So another element of what we do is we help patients navigate financial assistance, whether in Medicare, that's foundational patient assistance programs or various other couponing if they're not Medicare, just because we know that a high out-of-pocket cost is going to result in somebody struggling with their medication. So again, summarize, the two can coexist. You can have the efficiency and you can have the high quality, the high touch. And that sort of is where we get to that 87% net promoter score.
Okay, let me see if I could summarize some of that. So we're talking about high touch with humans, AI to support the humans, but also to help with logistics. So it's sort of AI automation with a clinical wraparound. We've got the pharmacist front and center asking questions. For certain chronic diseases, we've created centers of excellence that includes nurses as well. So we could get them in. So we have that. We have sort of I'm going to call it I don't want to minimize the program. So we're just going to call it for the most of the population, they get the high touch with the pharmacists. For certain chronic diseases, they get access to your centers of excellence approaches. Maybe that's an external facing or just an internal facing term. And that's where you have nurses and some other more whole person approaches. You have technology to enable the pharmacist to be more efficient, be able to do a little bit more. And then you have a navigation program to help with individuals that may have cost barriers.
Exactly.
Really, really interesting. Is there one thing, Bethany, if there was one thing, this is a hard question, but what's the one key component to ensuring you could deliver and execute on a program that seems that sophisticated and is obviously being executed well with the results you shared with us at the beginning? What's the one thing that is...
Yeah. First off, it's going to be a simple answer, but it's a very complicated leadership exercise. And that's the culture that we've created and the clear vision and strategy that we've established, where we have everyone running in the same direction, right? And all feeling empowered and motivated to do what's right by the patient. And that has taken a lot of work.
We're going to come back to that. I'm going to come back to you on culture. All right, folks, we're going to get in there. Incidentally, in about 20 minutes, everyone, if you're watching live or listening live, you're going to get a survey from us, as you always do if you're a regular. Those surveys are critical in how we continue to enhance how we deliver this information to all of you. One of the pieces of feedback we got to land last year was, do we have to register each and every time if we're coming each and every week? So we tried to improve that. What we do is we put up right now some of the upcoming episodes, and we'll register for you if you want to come to these. November 6th, we're covering from hospitals to home, and we're going to talk about remote specialty care, hospitals at home, and closing gaps, reducing readmissions. And then beginning December, we've got a really exciting episode on the Hidden Stars opportunity, which will be really timely, with stars coming out, I believe, on Friday or Monday. So we're going to talk about specialty care as the engine for member retention and experience. We'll register you guys for those if you want. And incidentally, another piece of feedback we always get is, I wish there were notes. So whether you complete the survey or not, because we love you, we're going to send you a key insight summary of notes from today's show just for attending today. So that's coming to you guys, whether you give us those 2 or 3 minutes of feedback or not. So let me shift now to and build off what we just heard from Bethany and Humana, and come back to Cody. Cody, building on that high touch example, how are regional plans transforming member engagement programs and driving actual lifestyle and behavioral change for those living with, let's say, comorbidities, cardio-metabolic disease?
Yeah, so we work with a regional plan out of the Northeast, and they've taken a little bit different approach, where a lot of organizations right now are laser focused on GLP-1s, and understandably so. But what they've done is really started looking upstream. So the strategy was more about managing members before they get to a place where they need GLP-1s. And the thought was, can we get to them and help them before that cost comes through? So with them, we implemented a full metabolic program that uniquely goes across their entire book of business. So not only fully insured, but their ASO. And what I do think is fairly unique about this, most often with ASO, they make it opt-in. In this case, they did an opt-out model. So the groups actually had to actively say they didn't want to be part of it. And I think that conviction and simplicity has been a bit of a game changer. We've seen with the ASO groups, over 90% have actually opted into the program. I think the results hopefully speak for themselves. In just over 2 years, close to 15% of their entire population has enrolled in the program. I want to highlight that the entire population, not just those that might need help from a metabolic perspective. They told us it's the highest participation they've ever seen in a health program. But we believe that really didn't happen by accident. And there's a lot of things. Part of it is we worked very strategically together around a marketing campaign, and we wanted to meet members where they were at in their journey. You do the standard employer channels and some of the digital outreach, but we've done some unique things around geofencing and social media ads, where we can actually get to these members in their own communities and make it feel personal. And then it certainly helps that Noom has been around for 15 plus years in the consumer marketplace. So when you say we're working with the Noom, more often than not, your members know who that is and have heard of us in the past, which isn't always the case in healthcare. We do understand that success isn't just about enrollment, right? You got to keep them engaged once they get in the door. With this particular plan, over 60% of their monthly active users are daily active users, meaning they're engaging in the app every single day. That is typically seen as a world-class stat that you don't often see in digital health. You really only see in messaging apps or, social media like an Instagram or Facebook, something like that. Having said that, the program's not perfect, right? And we love that neither of us pretend that it is. There are certainly people and members that drop off, but they've put in something in their plan design where that member can come back and re-enroll. And we've seen close to just under 20,000 individuals that have re-enrolled in the program. Sometimes it's just not the right time. They're not ready to take that journey. So they've allowed these members to re-enroll, and we're tracking the success of those when they re-enroll, and we're seeing a lot more weight loss that second time around again. Maybe it just wasn't the right time. So we thought that kind of plan design really stands out, where they're kind of building off that trust they built, but they want the timing to be right. They want accessibility, and it's driving lasting behavior change at scale.
That is truly like a consumer-centered design, right? I mean, we all have gone to the gym for 3 months and then had something happen that disrupted our life, and we're out for 3 months, and then we come back. I mean, I haven't heard of a program like that that gives a little bit of opportunity for that second or third chance, because sometimes it sticks, right? So that's really thoughtful. Did you guys get through that by bringing patients together and talking to consumers? Like, how did you get there, and how do you get the health plans to buy into keeping that door open?
So we've talked a lot about, again, I'll go back to our consumer roots at Noom. We have an incredible amount of data on how that happens. Your exact point. I was a Noom customer myself. It wasn't the first time, it was the second time that I came back. So we have an incredible amount of data that we can show the plans that just because you're coming back the second time doesn't mean you're not going to be successful. And oftentimes it is that second time that you come back, you take what you learned from the first time and you iterate on that to go much, much deeper into the program. So we can use a lot of that data, the testing, the focus groups that we've spent the last 15 years building out to show them and why there is value in that. And then ultimately we can show the value on the back end and cost savings and some of that stuff.
Yeah, I like that. I was preparing for this episode. Your team gave me something that you guys call the GLP-1 integration playbook. What I'm going to do, what I'd like to do here is let folks get access to that. So, folks, there's a document. It's like a 17-page or so document called the GLP-1 integration playbook, and it's all about how to create a integrated, digitally led program, and it creates a nice good outline on how to do it to drive member engagement and outcomes, and you get access to all of this great data that Noom's collected by originally being a direct-to-consumer company, which is so important when you're designing your own products. If you want the cool stats around trends, economic impact of everything around weight loss and GLP-1s, it's littered with that in the beginning. If you want to skip ahead and get just to the integrated playbook, it's on page 13 or 14. We're going to offer that to you. I'll send it out to you after the show, and it'll give you a good guide, especially if you're creating a new pitch internally on product design or a new product internally, and you got to go up the food chain with it. This will give you a lot of good information, compliments of our friends at Noom. So we'll send that your way. Like I said, first 13 pages or so has a lot of real good data. And then right around page 13, they outline the integrated playbook there. And I highly encourage you guys to take a look at that. I'm going to come back now to Anjay Kalusek Abrahimi. She is, again, the Senior Director of Lifestyle Medicine over at Blue Shield. Anjay, every member's path, to better health looks different. Cody's already talked about that. And same with Bethany, they've alluded to that. So what approach has been the most effective in helping Blue Shield of California enable all your members to reach their goals?
Yeah, it's such a good question because you're right. Not one size does not fit all. And I love your Netflix example. When I see K-pop Demon Hunters in my feed, I know that somebody's been using my Netflix. So that's never going to go over well with me. No, but I think that the answer to this lies somewhere in the neighborhood of directed choice. So we want to give members choices so that they can select the programs, the approach that they want to take. When I was speaking earlier, I was talking that, some people want to do a lifestyle-based intervention. Some people want to get on a GLP-1 and be on it for life. Some people want to take a GLP-1 to use it sort of as that stepping stone to get to their goal. And then they ultimately want to try to get off of it. So we have a range of different programs and providers. And I think one of the things that we are working towards is that personalization. So right now we have the choice. We have all of the different things that people can do if they want to do, more of a vegan diet or a keto diet, or they want to be on the GLP-1. Like, we want to have all of the different approaches for them. We do have a provider that we work with, type 2 diabetes reversal program, and they've been really terrific at giving that range of different solutions. So there are members that come onto that program as type 2 diabetics on GLP-1 medications. Some of them continue on the GLP-1 medications, but they've really worked on a plan or a pathway for members to get off of the medication. And now that's a huge win for the member, but it's also a win for us from a cost perspective. In addition to the coming off of the GLP-1, we're seeing the weight loss, we're seeing reductions in hemoglobin A1C, and we're seeing a significant decrease in other medications. So again, I think it's really just this idea of give the member the right choice and then help guide them to the one that they want to choose.
Stuff. Angie, why don't you clear something up? And Bethany, jump in if you think this question was originally for you. But I have a question from the audience that says, if I heard correctly, Delucio de California uses AI for dispensing. If so, Angie, can you please expand on that?
I believe that is for Bethany.
I think it was too.
Yeah.
Yes, it was for me. We have like a ton of robotic automation and AI that really focuses on this dispensing. And I don't know if you guys have ever seen a mail order pharmacy or home delivery pharmacy, but like I would happily give you a tour of our 3 different sites. The automation and then the technology and the engineering that goes behind all of this pharmacy efficiency is just, it's wild. And everyone who has never seen it, has never experienced it before, that comes into our pharmacy is impressed just by the sheer automation and the number of scripts that we bang out in a day. So,
well, that's cool. And do you do that? I'm not looking for you to promote anyone. Did you bring a third party in to do that, or did you do it yourself with your internal team?
we have an internal team. So we've built 3 pharmacies in the tenure of Humana. We've switched the names a couple times.
The AI tools that you've incorporated into the pharmacy for the dispensing.
Some of which are vendors, some of which are not. Yep.
Let me, since I still have you here, maybe I planned this out, but let's talk about your GLP-1 strategy now.
Yep.
And how it was evolved. And can you talk about what your current approach, you support MA members, and especially how you're supporting MA members with, let's say, diabetes and obesity, which I'm sure are your 2 largest patient profiles when it comes to this drug category?
Yep. Let me first say that there is a ton of complexity in the pharmacy supply chain. I know this very deeply because I've spent 16 years managing 3 very unique businesses within the pharmacy space. What is also true is that complexity can sometimes create barriers to care and add costs. So in partnership with one of our pharmaceutical manufacturers, we worked to build a model where they could bring the lowest price of their FDA-approved GLP-1 to the market, simplifying the system. So CenterWell Pharmacy's model, as discussed earlier, provides the automation, the scale, the outcomes focused, the consumer centricity, and ultimately the credibility that the pharmaceutical manufacturer was looking for. Our digital front door made access simple and enabled that manufacturer to bring the lowest cash price of an FDA-approved GLP-1 to the market. And so, we're excited about where these programs can lead, how our highly efficient consumer-centric pharmacy can just be part of lowering costs and improving access on behalf of manufacturers. And so it's just getting started. And I just am so excited about the amazing progress that my team is doing, rethinking how the system can work, again, removing the complexity and creating a simple access point. So I'll say that for the pharmacy side, because that's where the CenterWell Pharmacy partnership is in conjunction with that branded pharmaceutical manufacturer. When you're talking about Humana and pivoting to Humana, as you may recall, weight loss is still a CMS excluded drug class. So it's technically not eligible for coverage within Medicare. But what I'll say is I'm incredibly proud of the clinical programs that we have within our PBM and pharmacy that support the 8+ million Medicare members that we have, balancing their holistic care. And that is inclusive of whatever cardiometabolic diseases that they may have. And so when we engage, we talk to the patient on how they're doing. We provide guidance on managing their side effects. We provide clinical interventions when we need to promote adherence or various behavioral nudges. I mean, hell, we help with food insecurity, right? And so again, covering the wide variety of obesity, of diabetes, of cardiometabolic health writ large. And all in all, we're still leaning in to support these Medicare members despite the absence of coverage in that line of business.
Wow. Okay. So tell me a little bit about, you're doing that through all the scale that you talked about, so you could offer the lowest cash price to your members. Can you give a sense of the percentage that you're allowed to get them off, and then how are you also leveraging all of that in the partnership you have with certain manufacturers to help folks with, let's say, diabetes, where we do have an included CMS category?
Yep. So I would say we offer roughly almost a 70% discount off of the drug. And that's what, let me just be very clear. That is not me doing it via efficiencies. That's the pharmaceutical manufacturer saying, via this mechanism, we can decrease our price from $1,300 to XYZ, right? $499, $399, $299. Sometimes they even discount it way further than that 70%, depending. So I would say it just enables a different price point to be available because we've protected the channel such that they get the data. They have the ability to scrub it. They have the transparency behind knowing that this claim is not going to be double billed for a rebate, for a fee, for 340B, etc. So we've enabled a channel that's not only consumer friendly and efficient, but it also protects sort of that claim such that they are, the pharmaceutical company, able to bring that lowest net price to the marketplace. So incredibly proud of that.
That's awesome. So, Cody, let's kind of shift gears a bit. Not shift gears, but let's shift strategies a bit. And let's talk about you've seen a lot of GLP-1 integration pilots. Some work, some haven't. Let's talk about one that's worked, where we balance clinical outcomes and cost control. And let's not talk about GLP-1 specifically, but just weight loss programs in sort of 23 and to current day, on what's standing out in a model that may be equally or as effective, let's say, as a really progressive program that we just heard from Humana, where they're offering these GLP-1s at an extreme discount by way of the manufacturer, and some of the other things they're doing with their digital integration. What are some examples that you've seen where folks are getting innovative at health plans and doing things a bit differently?
Yeah, absolutely. To your point, there's a lot going on out there. You hear about new bottles every day. One that I would highlight, conversely, is in the area that the GLP-1s are covered. And so this is with the National Health Plan, where they were working with a jumbo employer in the Midwest. They took a little bit different approach. They wanted to prioritize access and accountability rather than defaulting to a restrictive utilization management, like you see a lot of times. So instead of putting the GLP-1 behind a wall of prior auth, we built out a proprietary risk stratification model to understand individuals' unique profile. So every member is then evaluated and assigned a risk tier, and it's that tier that ultimately guides their therapy. Importantly, medication is an option for everyone, but not necessarily the same medication. So the lower risk individuals begin with a lower cost AOM, maybe a Contrave, a metformin, something like that, and they're doing it alongside structured lifestyle and behavior change. The higher risk individuals are those that don't see success in the first 6 months on that lower tier, ultimately have a path to a GLP-1. The beauty of the model is it's not GLP-1 or nothing. It's a continuum of care where behavior change and pharmacology are ultimately working together. I I think that is a really important piece there, is that when you think of it, these therapies, especially on the lower cost AOMs, they're certainly not as efficacious as a GLP-1, but there's a tendency for the behavior change and that medicine to amplify each other's results, right? So maybe you start to see weight loss with the medicine, you're going to engage in the behavior change more. You engage there, you see more weight loss to where you can start to get GLP-1-like results, even though you're not on a GLP-1. What this has done for us and the plan that we're working with here, these are early results, still in the first year, but nearly 60% of members are starting on a non-GLP-1 therapy, which offers obviously significant cost savings from that perspective. Conversely, or at the same time, 58% of all participants have lost clinically meaningful weight. And again, that's across those taking GLP-1s, those taking other medications. So we're seeing really, really good results from that, even though it's wrapping up in the first year. And I would expect that data set, the 58%, to mature where that number actually goes up. So for us, and I hope this is where the industry's headed, is you start to integrate the behavior change with different pharmacologies and kind of have these risk-based tiers. And ultimately, it's clinically responsible, it's financially sustainable, but more importantly, it's human-centered, where each of these individuals has a fair and personalized path to care.
Yeah, that's great. I hope folks, again, we'll send you the key insight summary, but you're hearing all kinds of different bright spots and approaches to taking better care of your members and also creating greater value for your organization that's paying for a lot of these things. This is great. I just want to also thank Noom one more time for supporting this episode. You guys should know their name already, but what they're doing, what they continue to evolve in their consumer-centric approach is just taking that clinical support that you just heard from Cody, tied to behavioral science and modern technology to help people just have a chance to actually change their life. Anyone that's tried to lose weight or achieve any kind of lifestyle change permanently, it's hard. And it's hard, and I'm guessing a lot of people who are listening and on this call have resources to support them. A lot of these members that we're talking to do not have the same resources we all do. And this is a program that's evidence-based. It's backed by over 50 peer-reviewed studies and multiple academic partnerships. They've been around for a long time. So I encourage you to check them out and see what they have to offer. Noom.com/health. One other thing I want to say, just to kind of go kind of off the script here a bit. If you go to brightspotsandhealthcare.com, folks, all of our episodes, we've been doing the show since 2014, are there. I challenge you to find me an episode where I allowed a chief commercial officer to be on the show. Go look. You're going to be there for hours and hours. Maybe you won't find anyone. Cody's on because he's the real deal. They are doing some great stuff at Noom. They have a great culture. And you heard his personal story. You heard his story about what his why is. And Cody, I'm going to embarrass you here a bit, but if you're watching the show, he has an incredibly professional background. But you heard that one of the things, his why that led him to Noom was to be more physically able to play sports with his kids and raise his kids out in the field. And if you look behind Cody, I'm going to ask you to move your head. Look at that, like right there. That's a proof. This guy's the real deal. He's got a basketball attached to that beautiful picture frame. I am sure that your wife loves when that basketball gets out of that, the kids out of it. But anyway, if you want to meet Cody just to learn what companies are doing, not necessarily to partner with Noom and get a sales pitch, but just to hear what's going on in the industry and what he's seeing, I'm going to make a personal introduction to that guy with the basketball hoop behind his head. If you want to kind of check out and talk to him just privately and learn a little bit more about maybe how he could help you do your job better and serve your members better, I'll make a personal introduction. So why don't you we'll put a poll up right now and I'll make a personal introduction to Cody after the show. Bethany, we talked about culture. You alluded to it, and I promised everyone we're going to get back to it. We're running out of time here, so I want to make sure we hit it right now. Cultural alignment is the single thing that you said, or culture was the single thing that allowed you to transform that high-touch a company that was built on outcomes to a high-touch, consumer-centric experience with those 87 NPS. So what changed inside of Humana, and what made sort of this consumer mindset become, rather than just jargon in a conference room, to be real?
Yeah, no, it's a great question. And I would just have to zoom out for 1 second and just say, like, Humana has gone through a crazy amount of cultural transformations and identity changes over the course of the years, right? Like starting as a nursing home, hospital, insurance company, health and well-being company, and now like our CEO's new push is going to a consumer healthcare company. And so we have a history and a tenure of going through these various transformations. And then more recently, again, still zoomed out at the CenterWell level, has made Humana more holistically focused on chronic care, right? Aligning the insurance company with CenterWell, the services delivery healthcare company. And so I would describe culture as a holistically consumer first kind of place for us right now, where we're trying to make everything from buying an insurance product to understanding what your insurance coverage is, to scheduling an appointment with your doctor and obtaining a prescription and getting it filled, simple. And it's like so much easier to say that than it actually is to execute that. But we drive it through mostly our company values. So caring, curious, and committed. And so all of those things lead up to how we show up on behalf of our members, our patients, however you want to describe that. But like being caring for the whole person is a key component number one. Being curious, right? Inviting feedback, diverse perspectives. I'm always the first to say, like, please tell me when I'm wrong. Please speak up and tell me this is a dumb idea. I'd rather know now from you, whom I trust, than to go down this path and spend all of this money making this dumb decision. And then just committed, right, is the third element, delivering upon our promises, holding ourselves to that high standard. And then I think the other thing I alluded to in the earlier answer is just having like an incredibly clear vision, right? And that was one of the missteps I made earlier in my career in this role, that I didn't sort of articulate the vision like I should have in the past. And once I've articulated here's where we're going, the progress towards that vision was really empowering to our associate base. And we've seen like 10-point improvements in clarity of the job, right? Engagement scores. Like we've seen the progress that comes with having a very clear vision. And so it just, again, I spend a ton of time communicating, a ton of time showing up transparently, a ton of time reiterating our vision. And it's all because I know if we're all rowing in that same direction, like we can get there faster and move even faster than I had ever dreamed of. And that's what's happening.
Love that. Caring, curious, and committed. That could be my 3 favorite company values that I've heard on the show. It's great.
They're good, right?
Really good. And you're going to remember them too. Cody, from taking a plan's vantage point here, and making sure like let's say success is just more than just pounds lost and prescriptions filled. What are some signals that plans are using now? And can you share an example of like a partnership where those broader measurements have led to a great kind of value-based impact?
Yeah. So, to your point, we're seeing a little bit of moving away from just the pounds lost, steps taken, and some of that. And on the more innovative side, they're realizing that those numbers don't really tell the whole story. So they're starting to ask, are members actually engaging in behaviors that drive outcomes? Is their overall health improving, physical, emotional, behavioral? And it's starting with how they measure engagement. So moving away from just app opens or that you synced your steps and some of those different things, those are all really kind of surface level signals, where the smarter metric is kind of the quality of the engagement. Are they interacting with their coach? Are they completing behavior change lessons? Are they engaging in self-reflection? Things that we know will actually or like ultimately turn into the outcomes and move the needle that everybody desires. From there, they're also kind of broadening the clinical view. So instead of only focusing on BMI or weight, it's more holistic. Is their MSK getting better? Is it getting worse? How's the mental health trending over time? Are they managing their stress, sleep, nutrition, and all of those things? So I guess in other words, is the whole person getting better, not just the numbers on the scale? And we're seeing a lot of conversations around that, where they're really leaning into that and then trying to, and starting in, this is earlier stages, but building a system around that and connecting all of these different data sources so you can better help the individual, where you start to understand what they're really doing. And oftentimes Noom is not the best option for maybe that individual, but they're starting to understand the whole person and having this as a resource where they can learn and deeply understand and then refer them out to other things within the plan because they're looking at it outside of just pounds lost and BMI. They're understanding that whole person.
That's great. Come tight on time. I'm going to try to get everything in here. Bethany, like you said that once you were able to clearly articulate the vision and where you wanted to go and how we were going to get there, that sort of empowered your associate base and things sort of took off from there. So I want to build upon that and the theme of just trust as currency. And like, let's go back to some experiences maybe outside of Humana that may have influenced how you approach building trust both internally with your team and externally with the market and how that impacts designing programs at Humana.
Yes, I think maybe I'll share a little bit of a personal story. Back in 2020, like you've had food insecurity and loneliness, right? Amplified by the COVID-19 pandemic. And so during like the holiday season, many places actually to find food were not open on Thanksgiving Day or even sort of during the December holiday season. And so my friend and I identified like a local restaurant that was making holiday meals to go. And we realized we could connect them to people in need that were maybe couldn't afford to be with their family, couldn't afford a meal. And we started with the local homebound neighbors and community members. And so the bright spot for me is how we made it simple, right? With a bit of logistics, a couple volunteers, a bit of money, a holiday meal could be delivered to somebody in need that felt like food from a friend or giving somebody like hope and joy in that moment. And so it started small. And while it has scaled over the years, I've had to take a step back and realize that this idea turned into a full-scale nonprofit that now addresses food insecurity, equity, belonging, all things that are critically tied to health, which is a passion of mine. And so I just felt like the connection to what this podcast is all about and solving the complex problems doesn't always require the complex solutions, as you say. Like sometimes it just takes that clear purpose and a little compassion. And that's sort of the elements, the clear purpose and a little compassion that I take into my work life as well as I approach sort of my team and the work that we do. So it's just like this podcast connected a lot of dots for me.
That is awesome. That is great. Message to my team. We want that clip. Get on that. Angie, close us out here. Let's look at the future space. Let's look at next year and beyond. And what's one of the largest regional health plans in the country? How are they thinking about what's next for weight management and cardiometabolic programs?
Yeah, so I think it's a two-pillared approach. Number one, first pillar is we need a clinician-centered approach. So for members that have the comorbidities, who are on the medications, who need that extra sort of high-touch support, that they have it and they have the ability to access it in a way that is totally seamless, right? But in addition to that, for those members that maybe don't need all of the clinician-centered approach, we still need a holistic kind of digital member experience where members can find, and Cody, to your point, it's not just the pounds lost or, how many times they clicked on the app. Members who are dealing with obesity or even overweight, they need help with potentially mental health support. They might need MSK support. So the Wellvolution platform kind of creates that suite of programs that people can engage in to address their holistic needs. And so I think for when we have Wellvolution right now, for what's next for us is really integrating that into the digital member experience so that members don't have to go find what they're looking for. It's just served up to them, back to the Netflix thing. I'm going to come back to that again, right? That the recommendations that work for them and their needs are immediately available to them.
Great stuff. Great way to end. Thank you. This was awesome. We got to do a sequel to this. It strikes me as we sit here, Q4, a lot of cities around the country are hosting marathons. It's like Marathon City if you're a runner. If you've ever watched one or you've ever participated in one, the real magic isn't in the first mile or the finish line. It's in the pacing and the preparation and those small, right, consistent choices that carry the athlete forward. And I would say the same is true, right, for integrating GLP-1 therapies. You've heard it from all three of our guests today, all these bright spots. The wins are coming from, not from one drug or one program alone. You heard a lot of different approaches. They're coming from steady work of connecting benefit design, behavioral support, lifestyle modification, and clinical strategy into the seamless journey that sustains outcomes over time. I hope the hour you took today with us was time well spent. We always work for that goal for all of you listening and watching. Thanks to our three amazing guests for the preparation and their teams that were behind them to help them prepare. A special shout out to today's producer on my team, Jessica Tenzer, for bringing this show together. We'd hope that you use the ideas, the bright spots shared in this conversation today to inspire your thinking and enhance your company's approach to improving healthcare for all of us. Have a great rest of your day. And remember, this is your Bright Spots in Healthcare podcast, everyone. Take care.